Medical billing process. Introduction. The insurance processing cycle ensures providers are paid for services rendered and includes submitting, reviewing, adjudicating, and approving or denying claims. Understanding this process helps healthcare providers, including midwives, birth centers, and billing companies, optimize revenue, prevent errors, reduce denials, and secure proper reimbursement. There's key steps in the insurance processing. Claim submission. The process starts when the healthcare provider submits a claim to the patient's insurance, usually electronically using the forms CMS 1500 or UB04. CMS 1500 is for professional, UB04 is for facility. The claim includes patient details, services, cost, and relevant codes. For example, diagnosis codes, procedure codes, modifier, place of service, to describe the care that's directly been provided. Important considerations: you need to make sure the claims are accurate and complete. Any errors or missing details will lead to delays and denials. Insurance verification. After submission, the insurance company verifies the patient's coverage by checking eligibility, plan type, benefits, and provider network status. This ensures services are covered and patients' costs like deductibles and/or copays are identified. Key details in verification: eligibility, benefits, are prior authorizations needed, and out-of-pocket direct costs the patient will owe. Claim review. After verifying coverage, the insurer reviews the claim for medical necessity and policy compliance. Codes, documentation, and coverage rules are examined to ensure accuracy and eligibility. There's key considerations when you have high-cost services like midwifery and specialized. You need to require extra documentation or prior auth before getting approved for the claim. Adjudication is when the insurer reviews the claim against the patient's policy to decide if it'll be paid, adjusted, or denied. Process checks diagnosis, procedure codes, medical necessity, and documentation. During this stage, the insurer may approve the claim in full for reimbursement, approve with adjustments, taking off the portion the patient owes, like the deductible, copay, or coinsurance, or completely deny the claim altogether due to non-coverage, mistakes, or lack of necessity. Examples of this: explanation of benefits. That would be the summary breakdown of the charges, the approval, the adjustments, or the flat out denials, and what is the exact rejection reason. Payment or denials. Based on the adjudication, the insurer either pays or denies the claim. If they're paid, the insurer sends a check to the provider. Once in a while, if it's out of network, I've seen it where the patient gets the check in the mail because they're assuming they paid for the services and they're getting refunded. So you need to have in your financial agreements that if a check comes to the patient's house, it has to go to the practitioner. Denials, the provider reviews the denial reason, and then you'll correct it based on that error and mistake, and then file the claim again. Appeals if necessary. If the claim is denied or underpaid, the provider may appeal by submitting corrections or extra documentation to justify the medical necessity. There's different steps for the appeal process, but typically you review the denial, gather the documents, submit the appeal in a timely manner, follow up as needed to make sure they got it, and the turnaround time, usually 10 to 30 days, you want to make sure you follow up. Appeals process can be lengthy, so if you can avoid them from the beginning, it's strongly recommended. Common challenges in insurance processing: the claims denials, not getting paid what you were supposed to, timely filing. Some insurances won't even accept it if they have strict turnover deadlines for claims being submitted. Complex coding, not putting the right codes for services, procedures, place of service can delay or reduce and require accuracy. It's really important. You want to prevent insurance fraud and give claims for the services that are rendered accurately. Why understanding these are really important. You want to avoid billing errors. It makes a lot of expenses. It delays processing. You're less likely to get paid. You're less likely that the patients will pay their balances. It's really vital for the heart of any medical practice, particularly a midwifery practice. When you're billing insurance, you need to get it right from the first time and follow up quickly on them. Enhancing your patient communication, allowing easy understanding of the claims, the benefits, the out-of-pocket costs, minimizing the denials. So really being proactive, getting your prior auths, doing the verification of benefits, putting all the information correct on. As a conclusion, insurance processing is key to efficient healthcare reimbursement. From submission to payment or denials, attention to detail and understanding insurance policies are vital for the success of anyone billing for midwifery practices. Mastery of these steps helps providers reduce denials, improve cash flow, ensure fair reimbursement, and manage patient expectations efficiently.